Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
All right, so let's go ahead and get started. So as the title suggests, today we are talking about how we can evaluate nutrition research. And just a quick reminder, the presentation today is brought to you by both the Cancer Support Community Atlanta as well as the Northside Hospital Cancer Institute's High Risk Program, which I'll highlight later in the presentation when we talk about some helpful resources that are available to you all. Okay, so in week one, just a little recap of what we've talked about so far in the Reducing Risk series. That way, if you missed the presentations, you can go back and listen to the recording if it sounds interesting to you. Week one, we talked about the guidelines for cancer prevention and risk of reduction of recurrence. Last week, we talked about embracing a plant-based diet. So that's always a really popular one, and glad we all got to do that. Today, like I mentioned, we're talking about evaluating nutrition research. And then next week, we're going to talk about managing some side effects of cancer treatment, specifically for cancer survivors. All right. So last week's challenge, after we talked a lot about plant-based eating, was to try one new plant-based recipe this week, and making sure that it has a plant-based source of protein, with examples being, your lentils, nuts, beans, tofu, other legumes. So does anybody want to pop on, unmute themselves and share their experience, or feel free to put it in the chat real quick? Did anyone have a good recipe they want to share? That's okay if not. I'll share what I did. So last week, I'm trying to think what was on my menu last week. I did switch from a more like egg-based breakfast to oatmeal with walnuts and blueberries. I've done that before. That's a regular in my rotation, but the walnuts are my protein source, and then I also use soy milk as well. That was my second protein source. I'll try to think throughout the presentation today if there was another plant-based recipe. I know I did some. I just can't remember what I ate for breakfast today, let alone last week, but let's see. Okay, so someone made bean soup with soy crumbles. That sounds really good. And I hope you enjoyed that. Let us know if you liked that, because that's a really great idea. I've never used soy crumbles in a soup before. Okay, we had another soup. So the soups are popular, but I guess it's this time of year. We had lentil soup with lots of veggies. I'm sure that was loaded down with all of those phytonutrients that we're talking about. And lentils are one of my favorite plant-based proteins because they have so much fiber, and they're also really high in iron. They're one of the highest plant-based protein sources of iron that we have. All right, thank y'all for sharing. If anyone else wanted to share, feel free to pop that in the chat, and I'll come back to those in a bit. But let's go ahead and dive into today's topic. So what we're going to do is we're going to discuss how to kind of look at nutrition research that we see, as well as go ahead and look at some specific claims that many of my patients bring up and they want a little bit more information on. Maybe they read something about a certain food and they want to know how it affects cancer risk. And then lastly, we'll talk about some different tools and resources that are available to us that might help you on your journey to reduce cancer risk or recurrence if you're a survivor. Okay, so why are we talking about this? Well, really, we are constantly bombarded with information of all types, but specifically nutrition information. So many people like to speak about nutrition because it affects all of us. We all have to get a source of nutrition, whether it's through food, which is how most of us get it, or even if it's through, tube feeding, that integral nutrition, that can be common with certain cancer types. We see it on TV, talk shows, social media. We read about it in magazines. There are so many books talking about nutrition research, and it can absolutely be overwhelming. But the other component is because it's so personal, because we all get our nutrition one way or the other. Everyone has their own experience and their own opinion. So unfortunately, and fortunately in many cases, this means that a lot of folks in our life like to bring their opinions to us. So you maybe have experienced that if you had a cancer diagnosis or just talking about general health with family or friends, and they say, well, this worked for me or this worked for my neighbor, it can be really hard to kind of sort through all the information that you're given at all times, even if it is from a trusted friend or family member or coworker. But one thing we want to keep in mind is that everyone's health blueprint is different. Even just in this oncology space, there's so many different types of cancer. And then within that, different types of cancer can be presented in different ways. We have different symptoms. We have different treatments, which have different side effects. So really, it's so personal. And we just want to make sure that we are doing the right thing for ourselves and for our personal health. Okay, well, 1 second. Sorry, someone coming in. Okay, so the first thing we're going to talk about are types of studies. So there's more than the two that I'm going to mention, but these are two that I see a lot with nutrition research. The first type of study is called observational studies. So in these studies, participants are observed and a specific outcome is measured. So it's clearly we're just looking at what's going on and looking at the outcomes. We're not putting in any kind of intervention or action designed to affect the outcome. So let me give a silly example. Now, this is definitely not a research study that would ever pass any board, but let's just say I wanted to look at the effect of apples on cancer risk. What I might do is get a group of people, let's say maybe I have 100 participants, and I might ask them how many apples they eat on average each week. And then over the course of maybe many years or their lifetime, I might look at how many of those individuals developed cancer, and did it look like higher apple intake was associated with increased cancer risk or reduced cancer risk. So I'm not actually telling them to eat more apples. We're just simply taking a look at what's going on. This can be really helpful in a lot of studies because it's inexpensive. You don't have to, like I said, pay someone to eat 4 apples a day or anything like that. And it's pretty easy to administer. The downside is they're all correlative, meaning we can't be certain that apples was or was not causing the outcome. It could be that the people who ate more apples and had lower cancer risk just so happened to also exercise more, and maybe that's what was having an impact. So there are definitely some limitations to observational studies. So this is important if you're coming across an article and it looks like an observational study and they're making a strong claim that yes, you absolutely need to eat this many apples a day and it will prevent you from developing cancer. That's kind of a sign in your mind like, okay, well, this is evidence. It's certainly not the end all be all. And maybe I shouldn't go crazy implementing this particular, suggestion without further exploring it. Okay, so the second kind of study is the interventional study. In this kind of study, participants are assigned to different groups with an action, treatment, or other intervention being applied. And then the differences between groups is measured. So carrying on our apple example, in this kind of study, there will be a group of maybe 50 folks who are given an apple a day, and then 50 other folks who are not given an apple a day. And after 1 year, maybe we would look at and see how many individuals develop cancer or not. To take it a step further, there's a kind of interventional study called randomized controlled trial, or RCTs is how you might see it if you're reading this online. So participants in an RCT are randomly assigned to a group, but the differentiating factor is kept from the groups. So they might not know if they're in the intervention group or the control group, meaning, let's say they were being given a supplement. They might not know if they're given an actual supplement or a placebo. This is considered the gold standard. Really, what's considered the gold standard is if both the participants don't know which group they're in, and if the folks who are evaluating the research also don't know which group they're in until the very, very end when all the data is collected and analyzed. So that is considered the gold standard. So if we're seeing multiple interventional studies on a topic, that's great because we know that there's a little bit more of a body of evidence to support the data, maybe across different ethnic groups, across different cultures, where we can really see the effects of these things a little bit more causative. It's not always still 100% causative, but a little bit more so than those observational studies. So these are important to just keep in mind. Not only the type of study, but also how many of those studies on a similar topic were conducted. All right. So now that you maybe are looking at an article or digging into a specific topic, there are some other questions that can be really helpful to ask yourself to determine if this is an article that we really want to take to heart, or maybe we just want to wait it out, or maybe we just want to toss it out the window. We say, hey, this isn't the best research, so let's not apply this. Okay, so the first question we want to ask, are the findings too good to be true? If a title is heavily clickbaity, if it says something like, this will cure your cancer, or, so-and-so eliminates cancer, if it sounds too good to be true, it probably is. It's probably not the most reliable. So we want to be cautious of those really clickbaity, articles and catchy, gimmicky titles. We also want to ask ourselves, where are we reading this information? Are we getting it from a news story where maybe someone is just kind of reporting on a story, but it's not their necessary, area of expertise, and maybe parts of the research is getting twisted? Is it on social media? Is it possibly an influencer who's getting paid to promote a certain product? Are we seeing it on a blog? The same thing might take place. Or are we going into a scientific journal and looking at it, the research in its original form? What can happen is, ideally, research starts in a scientific journal that gets published. And then what happens is these news stories, the rest of the media takes it and they reword it and they present it a certain way. So sometimes when that rewording happens, things can get lost in translation or unintentionally or sometimes intentionally warped in order to kind of push a certain agenda. So we have to be pretty careful with it. Okay. So once we're looking at where we're getting this from, so maybe we have determined, okay, this is a scientific journal. The next question is, what kind of study is it? You might notice in the interventional studies, sometimes they take place in humans, which would be preferred if we're looking at information that we can apply to our own lives. After all, we are human. But many times they take place in animals or even laboratory studies. So things like in, cell in a Petri dish. While this can be a great starting point for nutrition research, it's not the end all be all because these animal and lab studies are not always applicable to human health and to how certain things would work in our bodies versus how it would work in an animal or in a Petri dish. Okay. The next question, who sponsored the study and are there links to purchase a product or service? Essentially, who is benefiting or how is someone benefiting from putting this information out to the public? That's fairly self-explanatory. We know if someone is trying to market something or sell a product, they're likely going to maybe overinflate certain claims or word things in a certain way that will entice more people to purchase the product or service. Another question we might want to ask, how many participants were in the study? Oftentimes, we'll see great research, really promising, and then when you look at the nitty-gritty, they only really tested it in a handful of folks. And maybe within that handful of folks, there wasn't a great representation of ages or maybe health histories or ethnicities. And so the results can't be applied to the general population. Oftentimes, preliminary research will start in smaller studies, and then over time, as we start to see more links between certain information and certain outcomes, more studies might be made and they'll expand on the population. So that's a good sign is if we're seeing this in a larger population because we know it's going to have a certain impact on a greater majority of individuals. We also want to look at how long the study lasted. For example, if we are looking at the impact of, again, a certain supplement on our health, on maybe our stress levels, this is just an example. We're taking a supplement maybe for 12 weeks. We look at cortisol, which is our stress hormone. We see, okay, did this supplement lower cortisol? Maybe we find out that yes, it did. Over 12 weeks, it lowered cortisol without any negative interactions observed. But what we don't know is what about 12 years down the line? What about long-term implementing this intervention? Because what could happen is maybe, yeah, short-term it lowers cortisol, but long-term, what if this supplement had an ingredient or something in it that could actually increase cancer risk? So we just want to be careful with that. We want both short-term and long-term studies to support our claims. Lastly, do other studies support the findings? So as I mentioned earlier, as we gather information, oftentimes more and more studies will be conducted with different variations to see if we're getting the same outcome. If something has only been studied once, that's probably not something that we want to go ahead and implement. We want to have a lot more robust evidence to support that before we implement it into our own lives. Okay. So at this point, you might be feeling a little overwhelmed. Like, goodness, that's a lot I have to ask, a lot I have to dig into and figure out, especially if I am getting my research or my information from the internet, social media, etc. Well, I want to give you some tips for turning to some more trustworthy sources as well. Okay, so remember, evidence-based information, so something that's been peer-reviewed, that's been looked at, probably had to be accepted into a scientific journal, is what we want to look at the most. But if we just read these studies and we have no idea what's being said, I mean, oftentimes I read them and that's the case. I'm like, okay, let's get to the point. What is the point that this is trying to get to? So sometimes it is easier to go to those more web-based sources of information. So the most reliable sources of information are going to be health organizations that are staffed by credentialed medical and health professionals. I can give an example of this. I once had a patient who was really excited about this one diet that I had never heard of. And it was a diet that had a meal plan it wanted you to follow as well as supplements. And they said, oh, Dr. So-and-so, let's just say Dr. Smith, promoted this specific diet and supplement combination. Well, when I got on the website to look at it, I searched high and low on that website and could not find any information that any, sort of health organization was backing it up or any staffed medical professionals were on board. Really, to me, it just looked like marketing, and whoever created this supplement to make a product. So we want to be careful. We want to make sure that we're looking at information that's backed by credentialed medical experts. Accredited cancer centers are also great places to look for information. On the next slide, I have some examples, but Memorial Sloan Kettering is a great example of an accredited cancer center that puts a lot of information online for people to kind of sift through and get some more details on. Medical professional organizations are a great resource, and also government agencies. So things like the National Institute of Health can also be a great starting point. Of course, if this still leaves you with uncertainty, the best thing you can do is to turn to your trustworthy healthcare professional. This can be your oncologist, your pharmacist, your primary care, of course, your dietitian. Um, but you want to make sure that you're going to the health professional who specializes in the topic that you're wondering about or asking about. So, for example, you might have a hairdresser and you might have a mechanic that you go to often. You probably wouldn't swap and ask your mechanic to cut your hair when you're in a pinch. And you probably wouldn't ask your hairdresser to fix your car in a pinch, right? They have different specialties. In many cases, the same can be true for healthcare. So one thing I always like to point out, since we're here talking about nutrition, is the difference between a registered dietitian nutritionist and someone who's just a nutritionist. So the term nutritionist has no credentialing behind it. Anyone can claim to be a nutritionist. Really, anyone on this call could go and put up a website and say, I'm a nutritionist, come to me, pay me money for an hour, and I'll tell you what to eat. So we really want to be careful with that because like we mentioned, we don't want just anyone telling us what to put in our bodies, especially if we're talking about cancer. Okay. So a registered dietitian nutritionist is credentialed. We have both a minimum of a bachelor's degree in dietetics, and as of 2024, new dietitians entering the field will have to have a master's degree. We have all had to complete an accredited dietetic internship and pass a national board certified exam. To give you more peace of mind here in Georgia in order to practice, on top of being registered, we also have to be licensed. So you know that the person giving you your information knows what they're talking about and is going to really, it's really for your safety at the end of the day. So that's just something I like to point out because a lot of patients will come to me and say, hey, I worked with a nutritionist before cancer and they suggested this supplement or this path. And we'll kind of have to talk through, well, it was well intended, but actually that supplement can interfere with the chemotherapy you're on. So we have to just make sure we're being really careful. So that's one example. All right. So to give you some more specifics, here are some of my favorite websites returning to some trustworthy nutrition information. Of course, in session 1, we talked about those, 9 to 10 recommendations for reducing cancer risk that I was getting from the American Institute of Cancer Research. So I really like this website. They also align in messaging with the American Cancer Society. Both are a great source of information on cancer. They have a lot of the same information. They just word it differently. So you can kind of go and figure out if one or the other, is more up your alley. Like I mentioned earlier, the National Institutes for Health is a great website. I was on there just today looking through information on certain vitamins and minerals so I could double check the reference range of how much we should be getting. The National Library of Medicine is another national organization we can reference. There's also the American Dietetic Association, or eatright.org, is a great one. They have a lot of blog articles on certain topics. It's not all oncology specific. So, if you have a family, they have great resources on how to get your kids to eat healthier. If you have another chronic disease, they'll have information on it. So that's another one that I really like. I also really like Memorial Sloan Kettering Cancer Center, as I mentioned earlier. They're wonderful. They put out a lot of really great information. Just a bonus, another website that I like that is a little more blog style, so a little bit easier to kind of sift through, is called, I believe it's called cancerdietitian.com. And it's this woman who is an oncology dietitian, and she does a lot of myth busting on her website. So if you look in her blog and you have a topic that you're interested in, whether it's does soy impact cancer or does sugar feed cancer, a lot of the things we were maybe talking about in this series, she has also written about and put in article form. So that's another great website to check out if you have more cancer specific questions. Okay. So what's the bottom line? If it sounds too good to be true, it probably is, right? We want to be careful when looking at the research, but also when talking to non-credentialed health experts. Because sometimes when we're well-intended, we're going to someone for information, it can have negative consequences if we're just not careful and fully trusting in the person that we're talking to. But lastly, no single food or nutrient or component of food is going to be able to cure or prevent cancer completely. When it comes to nutrition, balance is key. So we mentioned last week that variety is really the spice of life. We want a wide variety of nutrient-dense food. And if we only focus on one food, if we only eat apples, even though it's plant-based, it's not going to give us that balance. It's not going to give us access to all of those great phytonutrients, micronutrients, and also the macronutrients that we need to live our healthiest lives. So keeping this last point in mind, now I want to shift gears a little bit and talk specifically about certain foods that have some claims behind them, many of which you've maybe seen in the media or heard about, and talk about what's true and what we can take from that information. Okay. So these foods we're talking about are often referenced as functional foods. A functional food is a food that has a potentially beneficial effect on our health. And of course, underlined, because we love to point this out, when consumed as part of a varied diet on a regular basis. So these can be foods that are whole foods, so just, a food as it's grown or as it's produced, but it can also include foods that have been fortified, enriched, or enhanced. All right, so let's get started. And the first functional food we're going to talk about is really more of a nutrient, and it's omega-3 fatty acids. So a common claim about omega-3 fatty acids is that they may reduce inflammation and provide both cardioprotective and immunomodulatory effects. So these are fancy words just to say the claim is omega-3s are good for our heart and good for our immune system and overall inflammation. So let's look at what this is. Okay, so omega-3 fatty acids are a type of polyunsaturated fatty acid. Now, they're kind of an exemption to the unsaturated versus saturated fat rule, where typically saturated fats are solid at room temperature and come from animals and are a little less heart healthy, whereas our unsaturated fats usually are liquid at room temperature and come from plants. So omega-3s are an exemption to the rule because they are found in fish sources. You can also get them from dietary supplements, which of course is man-made. So they have had very well researched benefits on our cardiovascular health. So this is kind of why I'm saying it's a exception to the animal versus plant rule with the fats, because even though it's coming from an animal and it is a fat, we do have a robust amount of information saying that it's heart healthy for us. It's included in the Mediterranean diet. Fish is a big part of the Mediterranean diet, which is one of those diets that has been most heavily studied for its impact on chronic diseases, including, that heart health and also cancer. Specifically, some of the research tells us that omega-3 fatty acids influence genes that can affect inflammation in a positive way. And then another research study called the Women's Healthy Eating and Living Study, which is one of the biggest studies we have regarding breast cancer and diet and nutrition. This study showed us that when we consumed certain amounts of certain types of omega-3 fatty acids, there was a reduced risk of breast cancer and also mortality for breast cancer. Again, this is not to say that omega-3 fatty acids cure or prevent cancer completely, but we do see that there are potentially some benefits when we consume omega-3 fatty acids and as part of the diet. And in fact, the 2020 to 2025 dietary guidelines for Americans does recommend including omega-3 fatty acids in the diet for chronic disease prevention. And just a side note, remember we talked about in session 1 that we prefer to get our nutrients from food form and form of instead of from supplements. So keep that in mind. And if you're curious, if you're not a big fish eater and you want the benefits of omega-3s, it might be a great idea to talk to your doctor or dietitian about adding in an omega-3 fatty acid supplement. But of course, as a dietitian, it's always our preference to try to get those things from food if we're able. All right. The next functional food we're going to look at is flaxseed. The claim is that flaxseed or flaxseed oil or supplements can prevent or cure cancer. So if you see this claim in a headline based on what we've already talked about today, that should be a red flag going off that, okay, we pretty much know that no single food can prevent or cure cancer. But why are they saying this? Like, let's look a little bit deeper into where they think that they can, state that claim. So flaxseed is actually the best non-fish source of omega-3 fatty acids. And they have a kind of acid in it called alpha-linoleic acid, which has been shown to have some positive benefits. Flaxseed also contains both soluble and insoluble fibers, and we know that higher fiber intake potentially decrease the risk of colorectal cancer, but they also help with preventing weight gain and overweight and obesity. And we know that the American Institute of Cancer Research recommends we take in higher fiber foods to help reduce our overall cancer risk. Okay, so far, flax seeds have fiber and they have those omega-3 fatty acids. They also have a phytonutrient in them called lignans, which have phytoestrogen properties. So again, phytonutrients are one of those things that help our body fight off disease and keeps us healthy. Okay, something we know about flaxseed is that brown is usually easier to digest. That doesn't mean you can't eat them whole, you certainly can, but for many folks, it's a lot easier to digest them when they have been ground. Okay, so when looking at cancer in flax seeds, most of the research on this topic was completed in animal studies. We do have some small studies in humans that do have some potential evidence that they can reduce prostate and breast cancer risk. So far, we have some good evidence that it might be helpful in humans. But there are a couple complications with flaxseed. We know that flaxseed oil should not be used with stool softeners or laxatives. It also might be contraindicated, meaning not recommended for patients with irritable bowel disease. And large doses may cause GI discomfort. So if you're someone who struggles with GI symptoms, we might want to think through whether flaxseed is right for you because of some of the properties, including the fiber that it has. Okay. So more random control trials in humans are needed to for sure say that flaxseed affects cancer development, which is why right now, even though there's some promising research on it, we're not including it in those 10 recommendations for reducing cancer risk. We need a lot more evidence. But it is more than likely safe and okay for many folks to consume as a part of a healthy diet to potentially decrease cancer risk. All right, I do see a question in the chat. Most questions I'll probably answer at the end, but while we're talking about flaxseed, I will go ahead and address this. So in what ways can you add flaxseed to your diet? So you can bake with flaxseed, but I like to add it into my smoothies. I'll add it into my oatmeal. I'll just sprinkle, a serving or even half a serving onto my oatmeal. If you're grinding it, you can kind of sneak it into a lot of things. Like the smoothies, it will hardly have a taste if it's already ground. Truthfully, whole, if you put it in a blender, you probably still won't really taste it. They're very small. I would suggest maybe looking, just honestly, you could just search for recipes online that use flaxseed, especially if you're a baker. That would be a great way to kind of like top some breads or some muffins to give your baked good a little bit more of a crunch if you can handle it in its full whole food form as opposed to the ground form. Because we are not, saying that this does prevent or cure cancer, right? We don't have the evidence for that. We know that no single food can prevent or cure cancer. There's not a recommended amount of flaxseed. I wouldn't recommend overdoing it. Like, we don't want to eat tablespoons of it a day because it is a large amount of fiber. It will possibly more than likely at higher intakes, cause some GI issues. But if you're buying flax seeds, ground or whole, and you look at that nutrition label, it'll tell you what a serving is. You could do a serving and feel comfortable with that. You could cut back to half a serving if it's just too much for whatever you're mixing into. We do see some benefits with it, even just a couple tablespoons per month. So even if you're just doing a teaspoon here or there, that can add up. And plus, we don't want to overdo any one food in our diet. So hopefully that answers that question. Okay. So next we're gonna talk about soy, which I know we discussed in session 1, but I wanted to include it again because in case anyone missed that session, and also this really is one of the most asked about functional foods. There are multiple claims with soy products. The first claim is that soy can prevent cancer. The second claim is the opposite. And some people still say that soy can increase risk of certain types of can increase certain types of cancer, including breast cancer and other hormone-related cancers. Okay, so what is a soybean? Soybeans are legumes native to Eastern Asia, and they're a great source of protein. They also have high fiber, a high fiber amount, and also what we call phytoestrogen. So they're really phytonutrients that were called phytoestrogens because they look a lot like estrogen in structure. They're much, much smaller. These phytoestrogens also have isoflavones in them. Okay, so isoflavones and phytoestrogens are kind of interchangeable words. So either one you can hear, but typically you'll see it in the media as phytoestrogen. Okay, so because it has a chemical structure similar to estrogen, it can bind to similar receptors in our body that estrogen can bind to. So this is where the claim that we should avoid soy products came from, because initially there was concern that if these little isoflavones could bind to the estrogen receptors, it would increase the estrogen in our body. In reality, what we know is these are not the same as female estrogen. They do not, not only do soy foods not contain estrogen, but they don't seem to increase estrogen in our body either by binding to these same receptors. In fact, more recent research and much more, larger scale, higher quality research suggests that soy is actually protective against breast cancer recurrence. This is partially because of some observational studies where we've looked at populations that consume more soy, and we see that they actually have lower rates of breast cancer incidence and recurrence. Now, there is less research on soy and other hormone-related cancers like the endometrial or ovarian cancers, but the research that we do have on it suggests that soy foods are safe for these women as well. So the current consensus among health experts is that breast cancer survivors can safely eat soy products without worrying that they're going to have cancer recurrence due to the estrogens in the soy. Now, again, similar to the flaxseed, we're not currently recommending that you do have soy. It's not in the dietary guidelines that yes, you need a certain amount of soy each day, but it is safe and potentially protective. So 1 to 2 servings of soy a day is probably, can be included in a healthy, well-balanced diet and might offer some protective benefits. All right. Next, we're going to look at green tea. So one of the claims is that active components of green tea can prevent cancer. So green tea is an herbal tea product, meaning it comes from the leaves of a plant. We know that plant foods, or in this case, plant beverages, are full of those polyphenols and phytonutrients. Green tea specifically comes from a plant that has the major polyphenol EGCG. I'm not going to try to pronounce the full word there. Okay, so this is a functional extract that we get from the leaves of the green tea plant. What we know is that in animal studies, green tea has been shown to inhibit tumorigenesis for various organs, meaning it can kind of reduce the rate that tumor cells grow in certain organs. Now, this is in animal models. In human models, the data has been pretty inconsistent. In 11 meta-analyses, so a meta-analysis looks at research on a certain topic across many different studies. In this particular, in 11 meta-analyses, 7 showed that green tea intake was correlated with a decreased cancer risk. Yet another meta-analysis showed no statistically significant association between green tea and cancer. So it's kind of been a toss-up. It goes back and forth. The other thing I will add is that in the studies that show that green tea intake reduced cancer risk, a lot of times these studies were in populations where they were either already drinking a very large amount of green tea. Like in some of them, it was like 7 cups of green tea a day in order to see any difference. So having 1 or 2 cups of green tea at this time, we're like, okay, we're not really sure what true impact that will have on cancer risk. I also want to note that there are some drug interactions with green tea. So some folks, it's not recommended to consume green tea, but also green tea does have caffeine in it. Of course, it's at much smaller amounts than coffee, but if you're someone who's been advised to avoid caffeine, or if it makes you jittery or increases your cortisol, then again, maybe this isn't right for you. So the bottom line here is that there's some evidence. So unless you're one of those people who you know that it's contraindicated, green tea may provide some anti-inflammatory benefits and therefore might help reduce chronic disease, including cancer. Okay. All right, so the last functional food before we move on to our next section that we're going to talk about is curcumin. So the claim is that curcumin may inhibit or slow the growth of cancer cells, and it has potent or strong anti-inflammatory properties. So what is curcumin? Curcumin is a polyphenol or phytonutrient found in the turmeric plant. Some new research, so we haven't been researching curcumin for very long, suggests that there might be some anti-cancer effects. However, the research is limited at this time and too limited for us to suggest that we use curcumin in cancer treatment or prevention. Okay, so I see a lot of my patients taking curcumin or turmeric supplement. Now, in order for curcumin to be bioavailable into our body, it has to be combined with piperine, a component in black pepper. So a lot of these supplements are adding piperine to it in order to improve absorption. But this can negatively impact the clearance of several drugs and medications. And there are also some other issues with supplementing with curcumin. Number one is it might prolong the process involved in blood clotting, meaning if you get a cut, it takes much longer for it to scab over or for the bleeding to stop. And to someone who has issues with that, who maybe their blood runs much thinner and they have issues with blood clotting to begin with, curcumin might be contraindicated. It can also affect iron absorption. And many cancer patients already have low iron or are taking chemos or medications that can affect the iron status. So we don't want to combine it with curcumin. That might also impact that. Lastly, the thing I'll say is that curcumin is, it's anti-inflammatory, so it's a kind of antioxidant. But when we're taking chemotherapy, what that is that in a way, it's introducing a kind of inflammation into our body to destroy the cancer cells. So it's a good kind of inflammation. In some cases, if we add in high doses of antioxidants, like you would get in a curcumin supplement, it can affect or make the chemotherapy not work as potently as your doctor prescribed it for you to be. So we really want to be careful with this. So I have never recommended turmeric or curcumin supplements for patients, but unless specifically contraindicated, it is appropriate to include turmeric or curcumin as part of a balanced diet in the food form or really in its kind of spice or seasoning form. So this isn't an appropriate amount that your body can handle without being at too high of a dose that, again, in part of a balanced diet can overall help reduce inflammation. Okay. All right. So next, I want to just go over some of the resources that are available to patients so who have been a part of the Northside Hospital Cancer Institute. Now, if you did not receive care at Northside Hospital, that is completely okay. I know Emory, Piedmont, some of the other big hospitals in Georgia also have a lot of these resources available. So hopefully this will be helpful for you to know maybe what you can ask about, ask your care team, who you can get connected with for a similar resource. Okay, so as promised, what I first wanted to mention is the high risk program. So this is a new program to the hospital that is aimed for individuals who are at increased risk of cancer, right now specifically breast and ovarian cancers, but do not have a cancer diagnosis. So that might be you, or if you did have a breast cancer or an ovarian cancer diagnosis, and your family members are concerned that they might be at increased risk because of genetics or family history, this would be a great program for them. What the high risk program does is formulate a personal care plan to help do cancer screening, risk management, and surveillance so that hopefully we're taking proactive steps to either prevent cancer from developing or catch it in its early stages. It consists of a nurse practitioner. We can do genetic testing with the high risk program. And of course, we also offer 2 complimentary nutrition visits to talk about exactly what we've talked about for the past 3 weeks, how to reduce cancer risk. So this is their contact information. If you're interested in learning more, if you think a family member might be interested in learning more, feel free to take a picture and pass that along. I mean, if anyone, I'll move on to the next slide, but if anyone wants me to come back to this later, I'd certainly. All right. We also have general outpatient nutrition. So again, if you didn't receive care through the NHCI, but you want to work with a dietitian, this is a great option. You do need a provider referral, and they offer in person, and newly, I believe as of the past week, they can now do telehealth appointments as well. But we offer these in person in Atlanta, Forsyth, and Cherokee locations. So again, a dietitian is a great resource if you want to specifically talk about some of these recommendations for you or to dive a little bit deeper into some of the research. There are also a lot of cancer screenings available to the community. Northside does regular skin, lung, breast, and prostate cancer screenings. Throughout the year, they might have them at different times. So if you're interested in some of these, feel free to call these numbers, these hotlines for a little bit more information. I believe most of these are free of charge as well. So it's just a community resource that the hospital likes to offer. Okay. Some other helpful resources are Northside's behavioral health. So if you are dealing with some stress, anxiety related to a cancer diagnosis, you want to talk to a professional, they're a wonderful resource. They can also help you get plugged in with some support groups. Of course, a lot of those support groups are here at Cancer Support Community, so you can also check out the CFC's website. If you are a tobacco user and you're wanting to cut back on tobacco use to reduce cancer risk or recurrence, Northside also offers smoking cessation programs throughout the year. And then lastly, of course, the cancer support community, which is near and dear to my heart and many of y'all's, seeing as that is how you found this presentation. So feel free to check out the website for upcoming programming. I know next month we're talking about eating for decreased appetite. We do nutrition for the newly diagnosed every month. So there's a lot of great additional nutrition resources provided to you through the CFC. All right, before I dive into the rest of the questions, I wanted to give you all another challenge for the next week related to what we've talked about today. So the first option, next time you see a nutrition article in the media, go through that checklist of questions to determine how reliable it is, or to determine if you want to take it a step further and look at the scientific article or ask your healthcare professional about it. The second tip, identify who your go-to healthcare professionals are to help you answer specific health-related questions. And then lastly, if you want to really be ahead of the game, you can either go ahead and book a cancer screening or look at the dates, get that on your calendar, or consider scheduling a nutrition appointment either with Northside or with the dietitians at your cancer institute.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.